Hello, everybody. I hope that everybody is doing well. My name is Howard Diallo, and I'm proudly serving as the chief of the Civil Society Unit in the United Nations Department of Global Communications here in New York City. We thank you for joining us online today for this special chat series, #Break the Chains, Shackling of People with Psychosocial Disabilities Worldwide. And this is part of our chat series that we normally do within the UN headquarters. Some of you may know that the chat series is an opportunity for us to partner with civil society organizations that have an expertise on a particular issue. And we do these chat series because it helps us to boost advocacy on key United Nations priority issues. It helps us also to share resources and best practices within civil society, the civil society community. And most of all, it helps us to promote and boost a call of action on particular issues that are key to the UN agenda. I want to give a special thank you to today's partner, Human Rights Watch, an NGO that has an association status with the Department of Global Communications, for partnering with us to do this chat today. We're happy to partner also with a former member of the DGC Youth Representative Steering Committee, Subhajit Shaha, who is now proudly serving with Human Rights Watch after finishing his studies. We are so proud of him and wish him the best in all his endeavors. Now, most importantly, the chat series today serves to mark the International Day of Persons with Disabilities, which is observed annually on 3 December. This day aims to promote the rights and well-being of persons with disabilities in all sectors of society, and it also works to increase awareness of the situation of persons with disabilities worldwide, in line with the Convention of the Rights of Persons with Disabilities. Now, I'm sure that you can agree that the global crisis of COVID-19 has highlighted the work on disability inclusion is imperative. People with disabilities numbering about 1 billion globally. And they're also one of the major sectors that are facing exclusions and have become invisible. And, we thought that this would really be an important topic for us to highlight today. So people with mental and psychosocial disabilities often experience severe human rights violations, discrimination, and stigma. And we hope that today's discussion, we will explore the inhumane practice of shackling of persons with mental health disabilities. It's our hope that today's discussion will shed light on an important topic that needs attention and also action at all levels. And we're not only talking about international levels or multilateral institutions, but attention at the family level, at the community level, in our neighborhoods, so as well as national and international spheres. So we have a great lineup of speakers today, who, amongst other issues, will present how you can join the global movement to #Break the Chains. Be sure also, as you're watching, to really engage on social media and help us to kick out this conversation globally using the hashtag Break the Chains. Now, it's been very interesting putting this session together with Human Rights Watch, but I really want to thank you and also thank all the panelists for being here with us today virtually. But I also want to give a really big thanks to Jayatma, the UN envoy on youth, who was instrumental in helping us to get a very strong and prominent youth voice, and the commitment of one of the SDG youth young leaders who you will hear from shortly. So I think I'm going to stop right here and pass it on to Mini Murthy, who is from the Medical Women's International Association. And I must say she belongs also to another awesome NGO that has a long-standing partnership and relationship with the Department of Global Communications. Thank you so much for being here with us today. Sit back, relax, and let's see what we're going to be learning. Thank you so much. Over to you, Mini.
Thank you so much, Hawa. Good morning, good evening, everybody in different time zones. Thank you so much for joining us. It gives me great privilege to serve as the moderator for this esteemed panel where we are talking about a very important topic, which unfortunately is not on everybody's mind. So Before I turn it over to our esteemed panelists, what I did this morning was actually I shackled myself using a piece of cloth to my chair while I was looking over my notes. And believe me, I tried to get up, I could not. I tried to walk, I had to drag the chair. The reason I did it, just to put myself for less than 5 minutes in the shoes of so many men, women, and girls who are shackled every day for no fault of theirs. And according to the World Health Organization, health is a state of complete physical, mental, and social well being, and not merely the absence of disease or infirmity. How can we expect people who are shackled to have a complete state of mental well-being? I experienced that. I mean, I've never been so, I would say this is one of the few times I was that distraught being shackled, self-shackled. But the difference is I could remove my shackle, ladies and gentlemen, but those who are shackled cannot. As we know, we are in COVID, we have a crisis. It's really great that we are having these discussions. But can you imagine what would happen? Now we cannot go out. So in a sense, we are shackled because we are practicing so many restrictions. But pre-COVID, can you imagine if you were shackled, you would say like, you better not do that to me. Unfortunately, these people do not have the same rights. It's a whole question of human rights. And I would really like to call all of you to support the work Human Rights Watch is doing. So please log on, tweet about it, tag about it. As a global community, we can make a difference. Just very briefly, some statistics, unfortunately or fortunately, I'm an evidence-based person. I always like to give numbers. Around the world, there are thousands of men, women, and children with health conditions who are shackled. Do you know, ladies and gentlemen, and our great youth, a big shout out to Subhajit for doing this and all our other youth, that pregnant women are shackled. Yes, pregnant women, I'm repeating that, have been shackled. And it is terrible because they cannot move. Even when giving birth, some of them have been shackled. And there are poignant accounts which really bring tears to your eyes, that how can you run away when you're giving birth? I mean, some of us who have children going through a delivery, you just want to, have a healthy child. And a lot of times, if you're shackled, you cannot do that because mentally you have a big burden. Not only do you have a physical burden, but a mental burden. As I'm going to hand it over to our first speaker, I just want to say the mental issues, the mental challenges people with shackles face, they can get depressed. They are what is called hyper vigilant, where every little sound startles you. They can get PTSD even after the shackles are removed. Let me tell you, they can suffer from PTSD. And as human beings, as global citizens, we are from different parts of the world, we care. But I think we really need to work to break the chains. And this is the 75th anniversary of the United Nations. It's the 25th anniversary of the declaration of the Beijing Platform for Action. And as Hava so eloquently said, we have the International Day of People with Disabilities, and we have our Human Rights Day coming up next month. So let us make a pledge as a global team, how we can work together. Thank you so much. So that being said, now it gives me great pleasure to call upon our first speaker, Ms. Armena Sharimovic. I hope I got your last name right. I was practicing it. And Armena is a lawyer and a senior researcher on disability rights at the Human Rights Watch. And she's passionate. She leads the organization's work on the protection of people with disabilities in situations of risk and humanitarian emergencies worldwide. So, Amina, you will be discussing today with the audience, your expertise, the issue of shackling of people with psychosocial disabilities across the world. Thank you so much. The floor is yours. And ladies and gentlemen, if you have questions, please type them in the Q&A. Thank you. Over to you now, Amina.
Thank you so much, Winnie. I really appreciate your introduction. So in October this year, Human Rights Watch launched a global report, which is called Living in Chains, which documented that hundreds of thousands of people with mental health conditions have been shackled once in their lifetime. Men, women, and children, some as young as 10 and as old as 86, are chained or locked in confined spaces for weeks, months, and even years. We have documented shackling in more than 60 countries around the world, including in Asia, Africa, Europe, the Middle East, and the Americas. And what we have found is frankly horrific. People can spend years chained to a tree, locked in their own house, a cage or sheep shed, or sometimes in overcrowded and unsanitary institutions. And why is this happening? It is happening because of widespread stigma against people with mental health conditions, and because governments fail to provide adequate, rights-respecting mental health services in the communities where people live. Those who are shackled live in extremely unsanitary and degrading conditions. Many are forced to sleep, urinate, defecate in one and the same confined area. When I visited one of those places, and I found women chained to their beds, some of them naked, a nun who was charged in that particular place told me that they are chaining people so that they don't run away. In addition to the bare beds where women were chained to, the only other thing that I saw in that room was a bucket that was next to their bed. And this is the bucket that they used to defecate and urinate. In this particular facility, all the staff, except one older guard, leaves the facility with the sun down. So by 6 p.m., everyone leaves, and these people are still shackled to their bed, and they remain in total darkness because there is no electricity in this particular facility. The youngest person that we found in this particular facility was only 13 years old. I think, though, that one of the worst things that I have seen is in a traditional healing center where I found a woman who had her leg completely pinned down to a tree trunk. Her upper body was naked, she couldn't move at all, and she was literally held in a shed with her leg pinned down without any ability to move. By the time when I met her, she has been there already for 3 weeks. We have to also say that, just as mentioned earlier, chaining can cause serious injuries and psychological distress. A woman that I have met who had been chained for 10 months in a facility, she told me that everything about this chaining is difficult. You feel like you want to take your life. Regardless of how you felt before you came here, you're going to get worse. I also want to emphasize that what Human Rights Watch found is that chaining is occurring on different kinds of places. So we are talking about religious healing centers, traditional healing centers, but also government-run facilities. So when I did research in a country in Africa, I went to a psychiatric hospital where they did tell me that they are not using any kind of restraints. And as I was walking around, just looking at the facility, I heard the sound of the shackle, a sound that I'm so used to after having done this research for a few years. And I got into that particular ward and found people in a psychiatric hospital held in shackles. And when we talk about shackles, I want you to imagine 2 iron rings that are put on your feet and sometimes even cemented to the ground. At the end of the day, we have to call shackling for what it is, torture. And UN experts agree. The UN expert on torture has said, without any doubt, that shackling amounts to torture. And frankly, having seen it firsthand, that is what it is. And this is also why we launched the global campaign called the Break the Chains, where we want to use a movement of people around the world and work together with mental health advocates, people with lived experiences, disability rights advocates, and anti-torture organizations to end the horrific practice of shackling people worldwide. We will show you now a video that tells you more about this particular campaign.
This is Laide. She dreams of opening a sweet shop one day. But she can't because she's been living in chains for months. Why? Simply because she has a mental health condition. Around the world, hundreds of thousands of people with mental health conditions are forced to live in chains because of stigma, fear, and government failure. Like Laide, they dream of freedom. Felix was chained to a tree for 5 years. Now he is free and dreams of belonging. He wants to be welcomed back into his community. Sodikin was locked in a tiny shed for over 8 years. This is where he ate, slept, and even went to the toilet. But after getting mental health support, Sodikin no longer lives in that shed. He became the family breadwinner, working at a clothing factory. His dream of one day having a family of his own can come true. People deserve to live in dignity, not chains. Together, we can break the chains.
And here we also want to call on all of you to really join us to break the chains. We will share a link to the website in the chat box, where you can click on the website and learn more about our campaign and join us in our effort to break the chains. I also will just end by sharing some impact that we already have had. One of the countries where we did the research included an explicit ban on chaining in their new mental health legislation draft, which is a huge impact, meaning that the government is about to recognize and to legally ban the use of chains. In another country, a high court of that country found that detention of people with mental health condition in a church was a violation of their fundamental rights and freedoms. And this particular case is actually a case that Human Rights Watch did a research on, where we found that more than 60 women, men, and children were chained in that facility in the church because they had a mental health condition. So please do join us to break the chains, join more than thousands of people who have already taken the pledge by clicking on the website.
Thank you so much, Amina, for your passion and your very heartwarming remarks. And now we will move on to our next speaker, Jenna Castellan. Welcome, Jenna. She's an internationally recognized neurodiversity advocate. And it's amazing that Jenna has recently been selected to be a young leader for the SDGs. So over to you, Jenna, and thank you for all the work you do. You're such a role model. Thank you.
Thank you so much for that introduction. My name is Jenna Castellan, and I am the young leader for the SDGs. I am autistic and have dyslexia, dyspraxia, and ADHD. Due to the societal stigma, prejudice, and misconceptions associated with these conditions, I was bullied at school for most of my life and have experienced many instances of societal injustice and disability discrimination. The societal inequalities and injustices I have faced motivated me to become a neurodiversity advocate. I believe that neurological differences such as autism and ADHD are natural variations of the human brain, a difference that has led to some of the greatest societal contributions and innovations, from Isaac Newton, Charles Darwin, Albert Einstein, to modern-day giants such as Steve Jobs, Bill Gates, and Mark Zuckerberg, who are all believed to be neurodiverse. Their contributions have driven progress and revolutionized our lives, yet this is rarely recognized because autism is seen as a disease that needs to be cured. When I was 16, I launched Neurodiversity Celebration Week, a campaign that aims to encourage schools to change their priority from only focusing on our deficits and weaknesses to also recognizing our strengths and talents. I currently have over 860 schools and 583,000 students from around the world taking part. As part of Neurodiversity Celebration Week, neurodiverse students from around the world are empowered to challenge the stigma, misconception, and prejudices associated with their conditions by educating others through giving presentations, putting on talent shows, giving assemblies, organizing guest speakers, and other similar activities. I've received hundreds of emails from students and their teachers thanking me for transforming the way the neurominority students are seen and the way that they perceive themselves. I am grateful for the opportunity to be speaking to you today because mental health, and in particular the treatment of autistic people in relation to their mental health, is an issue that is very important to me. 1 in 4 people will develop a mental health condition in their lifetime. Yet mental health continues to be one of the most neglected, stigmatized, and underfunded societal issues of our time. The global mental health crisis is more than just a health issue. It also encompasses the human rights of the most vulnerable members of our society. Therefore, it is critical to reframe and expand the global mental health initiatives, agendas, and conversations away from the narrow, medicalized focus. Mental health is influenced by a wide range of social and economic factors, such as income level, employment status, education level, material standards of living, physical health status, family cohesion, discrimination, violations of human rights, and adverse life experiences, including sexual abuse and child abuse. It is time for a new paradigm that also addresses the underlying social and economic factors that impact mental health, so that we can redesign the types of quality and accessible services that are needed if we are to exceed in addressing the global mental health crisis. Globally, it is estimated that 792 million people, or 1 in 10, including 1 in 5 children, have a mental health condition. Yet governments spend less than 2% of their health budgets on providing mental health services. If we are to succeed in addressing the global mental health crisis, governments need to begin prioritizing mental health, including addressing the stigma and the many misconceptions about mental health that still exist, as well as the societal inequalities that disproportionately affect people with mental health conditions. There are currently hundreds of thousands of men, women, and children with mental health conditions in over 60 countries who are regularly being chained or locked into confined spaces. The fact that shackling is practiced by families in many parts of the world because they believe that mental health conditions are caused by evil spirits, or because the individual has committed a sin, demonstrates the importance of providing mental health education and mental health services. Prioritizing mental health services is more important than ever. The COVID pandemic has deepened the global inequalities and injustice experienced by our society's most vulnerable members. Before the pandemic, there was already a crisis in social care funding, both for adults and children. Mental health services were underfunded and stretched beyond capacity. The pandemic has exacerbated this by disrupting access to mental health services and causing a spike in mental health issues. If there is to be any meaningful progress in addressing the global mental health crisis, people with mental health conditions and psychosocial disabilities must be allowed to meaningfully participate in the decisions that affect their lives. This includes enabling meaningful inclusion and having a role in the development and implementation of mental health legislation and policies. For example, in Romania, local mental health organizations and people with psychosocial disabilities formed coalitions to promote mental health services at the community level. These coalitions were successful in influencing government officials to visit mental health institutions and succeeded in increasing the government's stated commitment to implementing mental health reform. It is also critical to incorporate and integrate mental health across wider societal sectors, such as education, employment, and social welfare. It is time to shed the restrictive, compartmentalized, medicalized approach. If the stigma and misconceptions around mental health conditions and psychosocial disabilities are to be challenged, we will need to take a comprehensive and holistic approach that acknowledges that our mental health touches every stage and every aspect of our lives. It is not until governments prioritize investing in mental health services and our society reframes the way in which mental health conditions and psychosocial disabilities are viewed that people with these conditions will be treated with dignity and respect that all human beings deserve and are entitled to. Please could you show the first slide of my PowerPoint? Could you go back one slide, please? Thank you. As someone who is autistic, my life has been shaped by societal stigma, disability, and discrimination, and human rights violations that many autistic people face. There is still so much ignorance and so many misconceptions, and so much shame about mental health conditions. Although I want to stress that autism is not a mental health condition, the UK government defines autism as a mental disorder, along with conditions such as schizophrenia, which means that people in the UK can be hospitalised because they are autistic. The 2019 report by the UK Parliament's Joint Committee on Human Rights concluded that many young people who are autistic or have a learning disability are being detained inappropriately and in breach of their human rights. Please could you move on to the next slide, please? In the UK, there are currently more than 2,100 men, women, and children locked up in state-run or private mental health hospitals that are paid up to $4,000 a week for each patient. Autistic individuals are often placed in facilities that are many miles away from home, making it difficult for family and friends to visit, and are looked after by staff who lack appropriate training, supervision, and are ill-equipped to meet their needs. Next slide, please. These facilities are also inadequately regulated and overseen. As a consequence, many autistic people who are detained in these mental health hospitals have been severely mistreated and abused. The government is currently facing a lawsuit over the mistreatment and abuse of autistic people and people with learning disabilities. Although the government has been aware of the abuse at these institutions, it has done very little to address and prevent the abuse. Next slide, please. In a recent BBC Panorama investigative programme, reporters went undercover to film some of the serious abuse that takes place in some of these privately run mental health hospitals. These reports exposed how autistic people and people with learning disabilities were being intimidated, mocked, hit, abused, and restrained. Many are placed in self-isolation, drugged, and left to languish in inhuman and degrading conditions for years. Next slide, please. One autistic girl called Beth was 15 when she was detained in a privately run mental health hospital where she spent 21 months in solitary confinement. For almost 2 years, Beth lived in a bleak room measured 12 feet by 10 feet with only a plastic chair and a mattress. She had no physical contact, no access to fresh air, not even a window through which she could see out of. Meals were passed to her through a hatch in a steel door. After a long and public campaign, her father was eventually able to obtain her release. Since December, she has been provided with the appropriate support she has needed, and now is thriving. Sadly, there are still many children and adults in this situation. Next slide, please. The root of the problem lies in the government's failure to prioritise and appropriately fund mental health services. In 2019, in the UK, 1/4 of mental health referrals made by doctors were refused, and suicidal children have to wait an average of 2 months to access urgent treatment. Without the right mental health and social care support, many autistic people struggle, eventually hitting a crisis point which can lead to being detained in mental health hospitals that do not meet their needs. Next slide, please. The only way to address these human rights violations is for the government to invest in mental health and social care. When it comes to the treatment of autistic people, the government should also review the Mental Health Act so that autism is not classified as a mental disorder, and autistic people are not inappropriately placed in mental health hospitals. Next slide, please. Despite the horrific situation in the UK, I recognise that it is much worse in other parts of the world. It is therefore really important for global human rights organisations like the United Nations and Human Rights Watch to raise awareness of this global issue, and for human rights organisations to put pressure on governments to make mental health services a priority. Unless governments begin to tackle the shame and stigma around mental health conditions, increase funding, expanding and improving mental health services, and make all these services accessible, the abuse and degrading practices such as shackling will continue. Thank you so much.
Sienna, thank you so much. What an amazing young woman you are. I'm giving you a big cyber hug on behalf of everybody. You deserve it for all the work you're doing. You're an excellent role model. Thank you so much, and all the best as you continue in this journey bringing light and hope. Our next speaker is Ms. Natalie Drewbold, who is the Technical Officer for the Policy, Law, and Human Rights team of the WHO Department of Mental Health and Substance Abuse. And Natalie will discuss the important role of the World Health Organization to promote quality care and human rights in mental health. And also she will discuss the key areas of the work of the World Health Organization and the support in terms of capacity building. Thank you, Natalie. The floor is yours.
Thank you very much, Minnie. So first of all, let me thank the colleagues at Human Rights Watch and also the UN Department of Global Communications, the Civil Society unit, for inviting me to be part of this session. While many of us working in the area of mental health are all too familiar with the shackling that goes on of people with psychosocial disabilities in many different countries, the extent of the problem, as was highlighted in Human Rights Watch's recent report, really still manages to shock. You know, we learn that still today, and you know, I'm reiterating what both Armena and Sienna have said, still today hundreds of thousands of people, men, women and children, are being shackled or confined in some way. And also that this isn't happening in just 1 or 2 countries. We're talking about, as you know, Human Rights Watch has found, over 60 countries in all regions around the world. And also, as Human Rights Watch has highlighted, this shackling, this confinement, is the end result of deeply stigmatizing attitudes that exist in the area of mental health. But not only that, it's also about a lack of community-based services and supports for people with psychosocial disabilities and also for their families. And these practices of shackling and confinement not only result, as Armena pointed out, in immense harm to people's physical health, but also their mental health. And not only that, but it also serves to perpetuate people's isolation and exclusion from society. So people are prevented from leading, you know, full and inclusive lives in the community. They're deprived from opportunities to get an education, to get a job, to marry, to have children, all of which are fundamental rights that everyone should be able to exercise and enjoy. So if we're really seriously going to address this situation and really address these human rights violations, it's going to take much more than just a discrete human rights project or intervention in 1 or 2 countries. Really, what we need is human rights to inform and underpin all actions that are being taken at the different levels. So that means at the policy level, it means at the service level, and it also means at the practice level. And basically that is what we're aiming to achieve through the WHO Quality Rights Initiative. And so let me say a little bit about that now. We're essentially working in 4 areas with the Quality Rights Initiative. And the first area that I want to mention is capacity building. So capacity building around human rights and mental health. So, you know, when you think about it, human rights in mental health is kind of a vague concept for most people. It's, you know, what does it mean to promote human rights in mental health? So we really need to build capacity so that people really understand concretely, how do I respect people's rights when I am delivering services? How can we make human rights in mental health actionable? And we're happy to report that in order to achieve this, we've actually designed an entire training program, which consists on mental health and human rights issues. And the program includes both face-to-face training materials that can be used in workshops and so on, but also more recently, we developed the Quality Rights e-training platform. And this basically is allowing us to reach, engage, and train tens of thousands of people within and across countries on these critical issues, on stigma, discrimination, and so on. And what we're doing is we're continuously evaluating this training program. And what we've seen so far is that it has actually had significant impact in terms of changing people's attitudes around issues of stigma, around the rights of people with psychosocial disabilities in many different countries, low, middle, and high income countries, but also across many different stakeholders. So health professionals, mental health professionals, people with lived experience, families, and so on. Just to mention our second area of work, which is around community-based services and supports. As I said before, to end the practice of shackling, countries really need to put in place a full range of services and supports in the community. And of course, this has to include mental health services. And here we're talking about community-based mental health services that really respect people's rights. So not services that are isolating people from their communities, or that detain and treat them against their will, or that resort to coercive practices such as seclusion, restraint, shackling, and so on. Instead, what we're talking about is services that actually listen to people, that respect their autonomy, that address all the important areas of their, Sienna mentioned this, all the important areas of people's lives, their relationship, work, education, and so on, all of those critical areas, not just a very narrow focus on diagnosis, treatment, and symptom reduction. Really, we need services to be doing so much more. And so through the Quality Rights Initiative, we're working with countries on the one hand to assess and transform their existing services, the services that are already in place, so assessing them against international human rights standards and transforming them, you know, to align closer to the human rights standards, including the CRPD. And we have a set of tools in order to do that. And then in addition to that, what we're doing right now, it's the big focus of our work at the moment, is we're developing guidance that highlights good practice services from around the world that actually exist and are being run now, services that are not using coercion and that actually promote people's right and promote a person-centered recovery approach in mental health. And the idea with this is really to inspire governments to invest in the right kind of services that respect rights, not ones that resort to seclusion, restraint, isolation, and so on. Then the third area that I want to mention is around supporting civil society movements in countries. Civil society engagement, as we've said, in mental health is so essential, but what tends to happen is that people with psychosocial disabilities themselves get forgotten in the decision-making processes on issues that affect them. People with psychosocial disabilities need to be invited to sit at the table to discuss policy, to discuss law, to discuss service development, and to provide their perspectives on what is needed in all of these different areas. And quite frankly, all actions in mental health will fall short if countries aren't engaging strongly with civil society, not lip service, but real engagement with civil society actors, and in particular people with lived experience in this way. So through Quality Rights, we've developed several guidance materials around how to promote the stronger engagement with civil society at national level. And also what's been critical to our work is that civil society and people with lived experience, people with psychosocial disabilities themselves have informed every aspect of our work and really are integral to everything that we do. So let me just go to the fourth area of quality rights, which is around putting in place policies and laws which comply with international human rights standards, and in particular the CRPD. And I'm happy to say that we are currently collaborating with the UN Office of the High Commissioner for Human Rights, and with them we've started to draft guidance on how to develop human rights-oriented mental health legislation. So mental health-related legislation that aligns with the Convention on the Rights of Persons with Disabilities. Basically, we need laws that include provisions that once and for all will ban shackling, confinement, seclusion, and so on. We also need laws that prohibit discrimination and that promote the rights of people with psychosocial disabilities. So their right to live and work in the community, to have high quality community-based services, housing, education, and so on. So that in a nutshell are the different areas that we're working in at WHO in order to address the human rights issues in the area of mental health. I just want to add my voice to say how important and timely this Human Rights Watch campaign to break the chains is, and we really encourage everyone to get involved. Everyone has a role to play to bring these awful practices to an end once and for all, and it's really only through a unified action that we're going to be able to make a big difference. Thank you.
Thank you so much, Natalie, for your call to action and, telling us what is going on. Now we are turning over to Q&A. And we have quite a few questions. That means everybody was not asleep. They were awake. It's an amazing program, ladies. You set the house on fire. The first question, I think, is to you, Amina. I'm going to read it out. Please share some of the difficult reasons why people choose to shackle people they love. Some can, in fact, truly be a danger to themselves and others, and especially when no adequate services or care exist for them in the healthcare system. Over to you, Amina. Thank you. And may I request you all to keep your remarks to 1 minute so that we can get as many questions as possible. Thank you so much.
Absolutely. Thank you so much, Winnie, and thank you so much for the question asked. So indeed, what we have found in all the countries where we have done the research is that families feel that they have no other option but to shackle the loved ones or to lock them up. In one particular case, a child was shackled because her family was afraid that she might just run out to the street or that she might hurt herself. And we have seen it in several countries and families that we have spoken to. It's, often you can't really blame them, because you do feel that when you talk to them that they feel that that's the only option. And it really is, and that's why we have to go back to the lack of access to support services. And it's not only about access to support services in terms of mental health, but also social services. And also it's linked to the stigma around mental health, but there is a perceived assumption that if you do have a mental health condition, put yourself or others in danger. And it's really going back to how we tackle it. I just have to say that it is by ensuring that people with mental health conditions and psychosocial disabilities and their families do have access to right support in their communities, which currently does not exist in many of the places where we did the research.
So much, Amina. Thank you very much. And our next question is from one of our youth. This is to you, Sienna. How can we as youth dismantle the stigma that's associated with mental health conditions? Thank you.
Well, as I said in my speech, 792 million people, or 1 in 10 individuals, including 1 in 5 children, have a mental health condition. So odds are either you have a mental health condition or someone in your family or one of your friends, you know someone who has a mental health condition, and it's so common and yet there's all this stigma, all this misconception, all these misunderstandings, and we don't talk about it enough. People need to start, talking about mental health conditions. Governments need to start prioritizing it. We need to start fighting for governments to prioritize it, and it needs to become more of a conversation.
Thank you so much, Sienna. The next question is for you, Hawa. I think you're the best person to answer this. And it says, how can civil society organizations assist with the UN in addressing mental health issues arising in the community due to COVID-19 isolation and social distancing? Thank you.
Thank you, Minnie. Was that how can the UN support civil society organizations? I didn't hear the middle part.
Yes, it says, let me repeat that. Sorry if you didn't hear. That's the downside of technology. How can civil society organizations assist with the UN in addressing mental health issues arising in the community due to COVID-19 isolation and social distancing? This is really what's happening now. Thank you, Hawa.
Yeah. Thank you so much. I think that a lot of civil society organizations around the world are already doing this. The Civil Society Unit actually put a call for civil society stories in terms of how they are addressing COVID-19. So of course that was in all various areas, but specifically I guess with mental health and social well-being. I mean, WHO, I think even knows, more than, I can say. But I think that in terms of civil society organizations, there's so many different things that you can do. And I believe it kind of really depends to where you're located, what you're doing, what your resources are. But really some simple things, it's actually participating in a session like this. Whilst I was, on the downtime on a video, I was busy sharing this message on all my platforms, informing everybody within my networks, so that we as individuals, as organizations, as the United Nations are alert and aware of what's going on, and we're being proactive. I mean, it could be that you are doing specific activities in your neighborhoods. Sometimes less is best. Doing something small that's closer is, better than trying to mount something that's so big. I know some people who are, reaching out to different parts of society who are isolated, or who, maybe feeling some stress mentally in terms of grocery shopping, in terms of calling them on the phone. Of course, doing all these activities, keeping all the social distancing things, in their mind. I think also, I mean, we need to talk more about it. Talk more about it and, engage, more people within our networks. Because sometimes for me, I was very not aware about Shackling. You kind of think about it, I've maybe heard about it, but I was just really shocked in terms of how global and really how close it is even to me in New York City, that I don't have to go to Sierra Leone or to go on mission to experience this, that it also happens closer to home. So I think that for me, it's being proactive, being aware, sharing the message, thinking about small activities that can directly impact people, within our neighborhoods, within our communities, and just really keeping this issue on the table. Of course, this is just really a gut reaction, and there are really, so many substantive things that civil society organizations, and to know that it's not only you, it's not only the UN, it's really all of us that have a role. I think maybe Natalie said that in her presentation. So I'll stop here and pass it back to you, Minnie. Thank you so much for the question.
Thank you so much, Hawa. And now our next question, I'm going to have two of you answer it. The first, I will have Natalie, and then I'll come to you, Amina. Natalie, the question we have is, how do we move from a medicalized approach on psychosocial disabilities to a more community-based services? Thank you.
Thank you very much for the question. And yes, indeed, what we see in a lot of most parts of the world is a real sort of emphasis on the biomedical model of mental health care, which, as I said, really focuses very narrowly. It's a focus on diagnosis, treatment, you know, and management. And, you know, what we've been hearing more and more is that, you know, a lot of people find the sort of diagnosis side of thing very stigmatizing apart from anything else. And, you know, and it's also, as Sienna also highlighted, you know, it's not really dealing with the whole person, the person holistically. And this is what we need to change in mental health services. We need services that look at the person and work with the person comprehensively. You know, looking at, well, what is recovery for you? Where do you want to go in your life? And it might be for someone, it might be about relationships, reconnecting with people. It might be about getting a job or re-engaging with your educational system. It could be a whole range of things. And these are the things that sort of move us towards recovery. And so in terms of how do we move from a biomedical to a more sort of recovery-oriented, sort of focused approach, I think it's through education, it's through listening to people with lived experience first and foremost. We need to hear from people. What is it? What do you need in a service that's actually going to make a difference? And that's why I'm saying it's so essential to have people with lived experience sitting at the table, at the decision-making tables, helping with service development, so that we understand, you know, this is what's going to be beneficial to me. This is what is acceptable for me for a service. And this is what's unacceptable and what traumatizes me, and so on. So it's really listening, I would say, to people with psychosocial disabilities, allowing our services to be informed by their voice. And also it's about education. And I think, you know, out of sort of a frustration with this very narrow biomedical approach came what is known as the recovery approach, which is a much more holistic approach to services. And I think with more education around the rights of people with psychosocial disabilities and, you know, around what recovery is and how we can practice recovery, I think those are the sort of ways forward into really changing the service.
Thank you so much, Natalie. Amina, can I just give you like 15 seconds to give your valuable input, because we have 2 more questions. You know, people are like, as I said, people have said, the panel has started a fire, which hope I can burn and melt away the chains. So to you, Amina, please.
Thank you so much, Minnie. I just really wanted to underscore what Natalie said about the involvement of people with mental health conditions and psychosocial disabilities in everything, in this whole discussion as well. And I just wanted also to highlight an important aspect, and it is the Convention on the Rights of People with Disabilities, which really did have for the aim for us to move away from a medical view on disability to a human rights approach. And the one thing that I want to highlight here is the right to choose and the right to choice. That people with psychosocial disabilities and mental health conditions do have a right to decide what they want and whether and what does any kind of support look like for them. So I just really wanted to emphasize that, because we are talking around thousands and thousands of people with disabilities are deprived of the right to choose. They're deprived legally from their legal capacity, which gives them the right to make decisions about their healthcare, for example. So I just wanted to emphasize that we have to recognize that people with mental health conditions have a right to choose.
Thank you so much. And the next question, I guess, is to you too, Amina. With the launch of the Break the Chains campaign, what are some of the next steps individuals can take to combat mental health stigma? Thank you.
Thank you so much, Aisha, for this question. And I think Sienna can also chime in. But I would say that it's really just talking about it and learning and talking to people with psychosocial disabilities and learning from them and understanding what does it really mean. And it's just really, the fact is that many people tend to think that they don't know anyone with a mental health condition, but just as Sienna mentioned earlier, we all do. And it's really about just talking about it more openly and recognizing it as a human rights issue. And but I would really like to give the opportunity to Sienna to address this question as well.
Thank you, Sienna. While you're answering that, it's not that I want to burden you, but there's another question which just popped up from another youth. So I just want to say, while you answer that, can you also please answer this? How can we as individuals hold each other accountable? Do you have any resources you can share around mental health interventions with us, so that when we encounter somebody, so maybe, you know, your answer and these two questions tie in. So that's why I use the moderator privilege to put that in. Thank you.
Of course. I mean, I would like to definitely advocate for more education around mental health services. I think that a lot of the stigma around mental health comes from misunderstandings and misconceptions and people not getting proper, you know, mental health education. In the UK, especially, you know, we have classes in PSHE, which is, you know, your social well-being, and they don't focus on mental health. It's something that wasn't talked about, wasn't discussed, and it meant that a lot of my peers went on to develop mental health conditions and stigmatize themselves for it and feel even more anxiety and even more depression just because they felt alone in what they were experiencing. And they felt that other people were stigmatizing them for it because they had those internalized stigmas themselves. And then just feeling like they couldn't get help for it. And so I feel like there really needs to be more of an emphasis on education to reduce that stigma and holding yourself accountable. I would say, you know, if you see anything, you know, for me, I knew Beth, this 15-year-old who was, you know, kept in solitary confinement, and I was in conversation with her father, and I just remember feeling really hurt by everything that was going on, but it's very difficult to do things about it when it's the government. And I just decided, you know, you have to start talking about it. You know, you need to get onto social media, and anytime you see something like that, you have to use your platform to spread the message. And if enough people start talking about it, then maybe something will happen. I've been, you know, really encouraged by these, you know, online campaigns that I've seen, you know, the Change.org kind of campaigns that pop up where people will see something that is wrong and try to change it, and people need to start doing that more because I think it has a real impact.
Thank you, Sienna. Unfortunately, we've come to the end of our program. We have one last question. Natalie, may I request you to answer this in 15 to 20 seconds? It says, how is WHO monitoring national mental health law reforms around the world that often still allow for some form of coercion in exceptional circumstances? Thank you, Natalie.
Thank you for the question. With WHO, we have what's known as WHO Atlas, which gathers information on different things, including mental health law. In the mental health law, in the sort of gathering of information, we had a number of questions around, you know, CRPD compliance. However, you know, the accuracy of that information that we get back is not always so clear. And that is why basically there is a big gap. The Convention on the Rights of Persons with Disabilities really requires that countries rethink their mental health law entirely. And there's a big gap for governments as to how to do that. So that's the gap that we are trying to fill by this guidance that I said we're developing with the Office of the High Commissioner for Human Rights, which we will get out next year. That's the idea, is to get that guidance out next year, how to develop laws that comply with the CRPD, promote legal capacity, end coercion, and so on.
Thank you so much, Natalie. And as we come to the end of the program, it's been such a privilege moderating such a group of enthusiastic activists. And thank you so much, DGC, for all the work, and Human Rights Watch. It's amazing. And in summing up, it reminds me of Margaret Mead's quote, "It takes a small band of dedicated people to change the world." Indeed, that's all it does. And I see that small band in the presenters and all the people who joined. So please take out your phones now, tweet about this, join the campaign. Please break the chains. Let us do it together. Hashtag at UN with Civil Society, hashtag break the chains. Thank you so much from all of us here, signing off. Stay safe. Happy holidays. Let's break the chains. Thank you. Thank you, DGC. Thank you, DGC team. Thank you, Human Rights Watch, all the unseen hands who made this happen. Subhajit, Go for it. We are all so proud of you and all the other youth. Sienna, take care, and may your work inspire millions around the world. So proud of you. Thank you. Bye-bye.